Thank you very much, Kim. And where I come from, we actually have a name for every day for when the child is born. And Wednesday's child, which is when I was born, I'm afraid was full of woe. So I'm not quite sure how I changed the full of woe. I wished I'd been born on a Sunday, which is loving and giving. But what I just want to do is very briefly bring it all together. And you've seen this slide before with the global strategy for women's and children's health, every woman, every child, and country leadership and implementation being firmly at the foremost in terms of the actions that need to be taken. All of the different initiatives underneath, I haven't changed the slide, so Born Too Soon, much broader into Global Newborn Action Plan, but everything sitting under one umbrella with, importantly, information, 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 and accountability, accountability, accountability. And we did talk about accountability throughout this whole process. And I did mention before an independent expert review group that actually reports through to the Secretary General on an annual basis and looking at what actions are being taken in the commitments that have been taken by all different sectors, countries, private sector, NGOs, foundations, donors, etc. So just to be clear as to where the Global Newborn Action Plan sits in the place broadened from Born Too Soon, clearly under the global strategy for women's and children's health. And so where does it sit at country level? I think you heard quite nicely already from Olive, but just to put it into a pictorial aspect that you can actually think of a picture, I think all or most countries have a national health sector strategy or national health sector plan. Under this, you have a reproductive, newborn, child, and adolescent strategic plan. And again, most countries have a plan. Some countries are renewing their plans. Some countries are looking at what you have a plan to 2015 and what do you do from there. And these plans have pillars. So you may have a pillar for family planning, and with the Family Planning 2020, you may be re-looking at your plan to see, is that pillar of family planning adequate? Does it have the right targets? Does it have the right actions in it? You may well have a pillar, a roadmap for maternal health, or a roadmap for maternal newborn health, or a roadmap for maternal newborn child health within this plan. And again, you may be reviewing your roadmap to see, is this got the right actions? Because with the last 1,000 days, many countries are looking to see how they're accelerating actions. So you may well have looked, or you may be looking at this. We anticipate a pillar for newborn health. Now this may be merged into maternal newborn or maternal newborn child, but re-looking at the pillar on newborn in the light of the new information that you have. Are the targets strong enough? Are the indicators there? Are the actions there at country level? That will move the newborn forward. And again, for the child, you may already have IMCI, you may already have integrated case management. We just launched a global plan for pneumonia and diarrhea. Are you re-looking to see if the targets are there and the key actions are there in an integrated manner? Underlying all of this, we have the health systems issues, the commodities, the human resources, the financing, which actually cut right across each of these pillars and lead through the reproductive, maternal newborn child health strategic plan, but also contribute to the overall national health sector plan. And the skilled health worker, that whichever skills you want to make sure that they have, needs to be part of that overall framework. So I just wanted to present this so that you have a picture in your mind that this all does link together. That we're not saying go off and do something completely separate. What we're saying is within the framework of your national health sector plans, your reproductive maternal newborn child strategic plans, you actually relook at the newborn section to see how is this fitting in with our new information, new knowledge, our targets. Do we have the right commodities? Do we have the right health workers? Thank you.